Intravenous access is often thought to be difficult in children and young infants. In fact, some of the commonest reasons for referral to higher institutes is the lack of confidence or the inability to secure IV access in seriously ill children. In this video, let us discuss how to secure intravenous access in sick children. Step 1. Organize an IV access tray. Choose the age-appropriate IV cannula. The yellow cannula is used in infants, the blue one in children, the pink is useful in adolescents, older children and adults. Step 2. Get help. IV access is difficult in shocked children. So how does the assistant help? He holds a limb above and below the site of IV access. The hand above the IV site encircles the limb and applies tourniquet-like pressure to make the vein engorged or visible. With the assistant's other hand, stretch the skin downward over the IV site. Step 3. Choose the correct site. Dorsum or top of the hand or wrist, cubital fossa or top of the elbow, along the medial malleolus in the foot. Choose the largest, most accessible vein without interrupting resuscitative efforts. Choose long, straight and unbranched veins. A good vein is ideally soft, compressible and non-pulsatile on palpation. Pulsatile indicates that it's an artery and not a vein. Step 4. Perform hand hygiene, don clean gloves, decontaminate skin with antiseptic and allow it to air dry for 30 seconds. Maintain asepsis throughout the procedure. Do not touch the prepared site, catheter tip, needle or catheter hub. It's ideally a no-touch technique. Step 5. Procedure. Grip the cannula by the wings with the thumb and forefinger. Using the other hand, stretch the skin taut to stabilize the vein. Prick the skin with the catheter and needle together at about 10 to 15 degrees angle just distal to the vein. Slowly advance along the line of the vein till a flash of blood appears on the hub. If you just see a drop of blood and not a flash, it indicates that part of the bevel needle tip is still outside the vein and it must be advanced further by about 1 to 2 millimeters to get a flash of blood. Once it is seen, stop advancing further. However, this sign, that is the flash of blood, may not be obvious in children who are dehydrated or shocked. Withdraw the needle by a few millimeters. Advance the catheter alone over the needle till the catheter hub sits snugly on the skin. Withdraw the needle fully and dispose in a sharp, disposable container at the earliest to avoid needle stick injuries. Look for free backflow of blood to ensure correct placement. Once confirmed, apply firm pressure, finger pressure, just proximal to the catheter tip over the vein to prevent blood loss. Samples can be collected at this point. Flush the catheter with 0.9% saline and look for resistance to flow or signs of extravasation like swelling or pain. If present, the catheter needs to be removed and re-sited. Apply firm pressure with cotton or gauze in the original insertion site for a few minutes to prevent blood loss or hematoma formation. Step 7. Fix it. If no extravasation is noted, cap the hub with the adapter. Fix securely with dressing, splints and tapes as required. Key points to remember. Choose the age-appropriate IV cannula. Secure the cannula well, as accidental dislodgement is common in children. Monitor it for extravasation. Common errors to avoid: failure to stock the IV access tray, failure to immobilize the limb sufficiently during the procedure, failure to maintain asepsis, needle stick injuries to healthcare workers secondary to improper sharps handling. So in summary, intravenous access, in this video we've seen where to locate the veins, how to hold the child and the limb before securing the line, what aseptic precautions we need to take, and how to fix it.